Welcome everyone to our Virginia Suicide Prevention Month, which is September. And this is Gwen Young. I'm a Student Services Specialist from the Virginia Department of Education. Wanted to welcome everybody to our weekly webinars for school-based mental health professionals, which aligns with the theme of Be the One To. Our first week, which started back in early September, was Be the One to Ask. Then it was Be the One to Be There. Third week was Be the One to Keep them safe. The fourth week was Be the One to help them connect. And this is the final week, Be the One to follow up. I wanted to welcome everybody else from this team. First, we have Emily Klein, who is a youth strength and conditioning coach. She is a mental health advocate and a NAMI presenter. We also have Ashley O'Brien from Newport Academy. She is a clinical outreach specialist with Newport Healthcare for the DMV area. And we also have Christine Stone, one of our other student services specialists. She is a project manager for the school-based mental health grant. So this is a community-wide effort. It's not just with VDOE. We have collaborated with the Virginia School Counselor Association, the Virginia Alliance for School Counseling, the Virginia Department of Behavioral Health and Developmental Services, the Virginia Department of Health, the Department of Criminal Justice Services, the Virginia Academy of School Psychologists, Newport Academy, and the Virginia Association for School Social Workers. So this is really meant to be a community-wide effort, not just within the school settings, but across the communities.
Welcome to week 5, Be the One to Follow Up. We'll discuss planned ongoing contact, revisiting safety plan, and talk about strategies and tools you can use when reaching out to someone in need.
Planned ongoing contact. Set some time aside to reach out to the student and the family. Consider different ways of reaching out and ask if any additional support is needed. That can be through a recovery peer or a mentor, through community services board in your community, mental health professionals, specific support groups for that student, or higher levels of care such as inpatient residential settings, PHP or IOP. You never know someone's journey. Student self-harming or experiencing suicidal ideation is one of the most challenging behaviors that administrators, teachers, and counselor staff encounter in the schools. Approximately 14 to 17% of children up to age of 18 have deliberately cut, scratched, pinched, burned, bruised, hoarded pills, or participated in risky behaviors at least once. 5 to 8% of adolescents are presently engaging in this behavior.
Thank you, Ashley. Really important in regards to ongoing contact is following up, which is obviously the theme of our last week here, week 5 for Suicide Prevention Month. Within this PowerPoint slide, you guys will be able to click on the title, Follow Up Matters. It's a really great website and resource, again, emphasizing following up with student and families regarding suicide prevention if a student were to verbalize suicidal ideation or thought. Studies does show that ongoing contact is an important part of suicide prevention, especially for students that have been discharged from other intensive care services out in the community. And the big benefit, as they found within this website, a lot of data articles, is that it does reduce hospital readmissions and additional emergency department visits when there is follow-up and ongoing contact with that student and family. Quickly, these are just 5 simple ways that you can follow up with that student is, make that phone call, definitely within a virtual setting, just being able to connect with them and talk to them, whether in person or on the phone, sending a text message, even simple things like writing a letter or a small note. Conducting a home visit, being, a school staff, you can certainly partner up with maybe another trusted teacher or someone from the school-based mental health team to do that home visit with that for that student and family. And also you can certainly connect by writing an email or other means through technology or social media. revisiting a safety plan, and really some things why it is important to revisit that safety plan as part of following up is really collaborating with that student, with that parent or caregiver, and the school's mental health team is important in order to revisit that safety plan. Really talking about what is currently working in that safety plan, what is not working, have any of those support systems change? Are there new peers, new trusted adults within the school or out, within the community that they want to include in that safety plan? And for those folks, updated telephone numbers, updated information. Also talking about some coping skills that may be no longer effective for that student, or maybe there's some new strategies that they have learned in regards to how they can cope with the mood and the emotions that they're experiencing. Also just want to highlight a note to definitely look back at week 3's webinar for additional resources of safety strategies and how to keep students safe. And I just really like the quote up here. I think everybody can relate to that. To get through the hardest journey, we need to take only one step at a time, but we must keep on stepping.
And some strategies and coping skills in a toolkit that a student can use is journaling, getting outside in nature, staying active, such as some activities they can do is yoga, hiking, walking, swimming, self-affirmations. Ripping paper has been shown to be able to reduce stress and anxiety, finding a mentor or recovery friend, and surround yourself with those who lift you up and create a support circle. Knowing those go-to key folks that you have that rapport with, that you can confide in. And if you don't have access to some of these strategies at the moment, you can also practice 4 square breathing, where you breathe in for 4, hold for 4, and then let out for 4.
So supporting their return to school, it's important to collaborate with the family to create a reentry plan for a student after a mental health crisis, a suicide attempt, or hospitalization. Holding the reentry meeting with the family, making them part of it is very important. So you'll work closely too with teachers to make sure they understand how to support the student within the classroom. Modifying student schedules or course load. Work with the teachers to allow makeup work or extended time without penalties. Arrange for tutoring or extra help, extra academic support as needed. As long as they feel supported, when they feel supported within the classroom and know that they'll have some stress lifted off of them, it can truly benefit the student. The number one preventative is that positive adult person in their life. So the more we can put in there, the better. So check-ins with the school counselor, the school psychologist, and social worker. Allow visits to the school nurse for medication or simply to take a breather. Care coordination with the discharge planning. So circling back with what's going on at home and making sure that we have a child that feels supported in the school will be the most important thing as part of the plan.
This week's challenge: how to check in on someone if you sense they're thinking about suicide. Please know that it's okay to be very direct when asking someone if they're thinking about it. There is research that shows that asking will not put the idea in someone's head. Most people will be relieved that someone cared enough to ask or even start the conversation, and assume you are the only one who will reach out. You could be the difference. If you think someone is struggling with their mental health, trust your gut and ask. Do not feel like there is a rule book on how to ask. It may feel uncomfortable to ask. So review tips from our week 1 webinar, Be the One to Ask. In some ways you can ask is, I feel that you have a lot going on. Is everything okay, really? Or how are you feeling today, really? This week's challenge continued. These are difficult conversations for anyone to have. Some additional resources to support in having this conversation can be available at the link I've attached, and help is always available at the National Suicide Prevention Lifeline at 1-800-273-TALK, and the crisis text line, text TALK to 741-741, and together we can help stop suicide. I also wrote a little tidbit I'd like to read aloud. Our hope here is to support our community in having these difficult conversations. While it has become increasingly more common to talk about mental health, particularly this past year, the topic of suicide, when it comes up, is still scary for many people to think about, let alone say the word suicide. Some may be afraid that by asking someone if they're having thoughts of suicide, it will put the idea in their head, or perhaps push them to take their own life, which research has shown is not true. Others are worried that they won't know what to do or how to help a person if they do say, yes, I am thinking about suicide. We see this as an opportunity to deepen the conversation. We all have mental health. It's time we take the next step, checking in on another's mental health, and if we need it, find help together. Together, we can help stop suicide.
Thank you everyone for joining our week 5 with the theme follow-up webinar series to really wrap up our suicide prevention month. We appreciate your attention and really absorbing all the information, but we certainly want to hear from you and what you're doing within your school division within your specific school. So definitely tweet us using the hashtag #BeTheOne2VA and hashtag #FollowUpVirginia to let us know and send us pictures and things like that. We'd love to hear about the strategies and things that you're doing within your specific school division. So thank you, everyone.